back again in Sao Paulo with Dr. Reginaldo Filho, who is the director of EBRAMEC.
Yeah, thank you.
Could you tell us more about, so if one is interesting, I know you're promoting the Chinese culture here in Brazil, so it's not only education, but could you tell us about what is the structure of the education? Like, for example, first-time student, how do I begin?
The first thing is, we need to recall that in the Western, when we say Chinese medicine, most of the times is acupuncture. So our main program is acupuncture program. So normally I will tell the students that they are entering a new way of thinking. That's what they need to understand. It's not just I'm learning a tool, like I'm a physiotherapist or a nurse and I want to have a new tool for working. If you start that way, maybe you have some success. But if you understand that Chinese medicine is a new way of understanding the body and the health and of course the disease, then you are one step ahead and then you can grasp deeper the understanding of Chinese medicine. So I explain them that. Afterwards, I tell them that acupuncture is a really powerful way of treating the patient. We look at the patient, we understand the patient through Chinese medicine, but then we need to have a way of getting the patient back to their own health. And this way of understanding, not just for treating, but for a way of understanding, in the way I see Chinese medicine through my studies in China, pass through the understanding of Chinese thinking and Chinese culture. If you are Chinese, you already are raised with the understanding of yin and yang and five movements, even if you don't know how to apply it for medicine, but that's regular concept. Here in Brazil, no one knows about yin, yang, or five movements, or they just think that yin and yang, the symbol of Tai Chi, represents something. And even worse, sometimes they give moral values to those symbols and say, oh, yin and yang represents good and health, God and devil. That's not Chinese philosophy, that's not Chinese thinking, that's not Chinese culture, and that's not even close to Chinese medicine. So that's why I believe that we need to understand a little bit of the culture, because we break this. Brazil is a very religious country, not a specific religion, but people are religious or spiritual. And sometimes when you say that yin and yang is the balance, the same level of evil and good, people that has some beliefs, they said, oh, that's not what I learned, that's not for me, that is so different. Then first I need to break it. So promoting Chinese medicine together with Chinese culture is important. More important nowadays in a world that people, sometimes they only see two things. Either you are from this side or from the other side, or either I like that way of thinking, I don't like that way of thinking, or I believe it or I don't believe it. I say that Chinese medicine is not for believing, it's for understanding. If you understand, then you can apply it. So going back to the question, I step by step tell the students or the person willing to be a student that they are not just learning a tool, they are learning a way of thinking. They are learning a way of understanding the patient. In the Western world, we just look at the patient and we see flesh, we see muscle, we see tendons, bones, nerves. We go for ancient books in Chinese medicine. They just look for the qi, for the channels and so on. Why don't we look at the same body in the combined way? So the motto of my college is tradition and modernity. We need to look at the patients that way. We cannot be stuck in the past, but we cannot remove the past from the Chinese medicine. So step by step, the students will be learning about the theories. Then he's going to diagnostic. Then he's going for syndrome. Then he is going for the acupoints. If you do the opposite way, people will think that acupoints are miraculous. They do not understand it. It would be much easier for the college, just teach the points. But the theory, that's the background, that's together with the culture. That's the way I believe Chinese medicine should be taught.
Yeah, and the one thing I like about, I think what you're saying is Brazilian people are religious people. They're more, of course, first of all, they're not familiar with Chinese medicine, but they are receptive. because they're already used to a concept of philosophy. So introducing Chinese philosophy to them, what is easier, I think.
The thing is, they are religious, but most Western world is more into like Christianity and Jewish religions. And sometimes depends on the lineage, if I can say that, or the way you profess your Christianity. Sometimes they are against everything they don't understand. So first I need to say that Chinese medicine is no religion. That's the thing.
Yeah.
So we need to break this, because some people try to force this idea. Oh, because I don't understand, this is some kind of mystic, esoteric, religious way. No, we need to break it. Then people are more and more willing to accept acupuncture. So the way I believe is that if more people accept acupuncture, in the future more people will say the good experience they had with acupuncture. That's why I promote the treating clinic with such a low price for the patient, because this way more people can afford, because of the economic situation in Brazil. If I put regular price, very few people could afford. So I put lower price, more people can afford acupuncture, more people can benefit from acupuncture, and in the future there will be a bigger market. Maybe I will not be here for this market, but I'm trying to build this market for future generations.
So if you want to study acupuncture here at the college, you start with, can you break it down for me? First year is basics, acupuncture.
Normally, all the program is separated in different modules. So we start with basic theory, then we go for the diagnostic, then we go for syndrome. This is the basic first step, or first semester, sometimes first year. After that, if you understand this basic, you could go for all the branches, because this is basic for not just acupuncture, but herbs, massage, and so on. But for acupuncture program, then we have a class on bioethics and needling. Afterwards, we have ear acupuncture, which is very common here in Brazil. Then we go for acupuncture points. After learning acupuncture points, then we have the different treatment options, such as moxibustion, cupping, gua sha, and so on. Then after that, the student already have the basic theory. He can understand the patient, he knows the acupoint, he knows the channels, he knows the methods. Then we have we call the applied disciplines. So we have afterwards how to use this knowledge for treating the extraordinary vessels, for example. How to use this knowledge for treating mental problems or orthopedic problems. Then we go for the applied one. And together, after this introduction, the student can start step by step going for the clinic. So here we have a minimum requirement of 500 hours of clinic in my college. So the students start just by observation, and after, through the supervisor inspection, and the students, we are getting more and more free way of leading to the clinic. So from observation to fully treating the patient, it depends on how he develops his skills.
Okay. And so how long in years would this program be?
We have here in Brazil, we have 3 kinds of programs in acupuncture, and I'm proud to say that we are the only one that can offer those 3 programs. So we have the so-called open or free programs. We have the post-graduation program, which is for those who has a prior bachelor degree, such as physiotherapy, nurse, speech therapist, and so on. And we have the undergraduate program. So for the free program and post-graduation, it's a minimum of 2 years. For the undergrad, it's 3 years program.
Okay.
And we were the first one to be approved by the Ministry of Education. Until now, we are the only one approved to offer the undergrad program. And this program will lead to a diploma. So it will be the first time program leading to an acupuncture diploma. And then after, the student can go for a master or a PhD if they want.
But you also have herbal medicine program.
Yeah,
right?
then we have the herbal medicine. It's a minimum of 18-month program. And we also have train-up program, a minimum of 12 months.
Okay. Nice.
I say minimum because it depends on the experience. Because those first 6 months, as I mentioned, they are basic requirement for all the other. So if the student is already an acupuncturist, he can take herbal for 18 months. If he's not an acupuncturist, he must take the 6 months and then the herbal program.
And then you also have the officially licensed online classes, or you were saying?
Yeah. We are approved by the Ministry of Education as in-person live college, but also we have another authorization as e-learning college or online college. So we also have many different programs online. We have the herbal program online. We have advanced acupuncture programs online. And we are just waiting for the Ministry of Education to visit in order to get a credit for our online acupuncture undergraduate program.
Okay.
But that's, I just need to say that, calm down, it's not 100% acupuncture online.
Yeah, no.
The thing is, when I have this accreditation, I can offer it in this college in Sao Paulo, but I can also offer in different parts of Brazil. But that's why I'm asking for online. Then we learned it through pandemic, terrific situation. We learned that some of the subjects are even better to be taught online. So we did some reviews on the grades of the students that took, before pandemic, the in-person, in-class discipline and the same discipline online. Some of them get higher grades when they are doing online because they can review. The way we do it, it's not just, some people say online live class. It's sometimes too difficult for the student to keep the attention when it's like longer classes. So what we do is a combination of live and recorded material. And this recorded material student can view and review as many times as they want. So we are combining those programs and we are trying to offer all the best possibility for the students.
And you also have like special guests, speakers from not from Brazil or international speakers?
Yes, we invite teachers from China, from Europe, from America to come to lecture here in Brazil to exchange the information and to expose our students to different way of thinking. I'm not those guys that said that the only way of thinking Chinese medicine is the way I present. No, I want my students to see that Chinese medicine has a very broad way of understanding and different styles, different methods. So we invite teachers from different countries. So normally we invite like a teacher from China to stay here for like 2-3 weeks, and they give weekend lectures, and during the week they treat patients in the clinic and the students can observe. So we do this kind of exchange. We have cooperation with some of the most famous universities in China, such as in Tianjin, Shanghai, Shandong, Zhejiang, Chengdu. And we invite those teachers here. And also we send our students to take classes and study over there. Besides this exchange where we invite teachers or send our students, we have also some cooperations with some countries, and then we receive students from these different countries to study here in Brazil. So recently we had a student from Canada that she was here in Brazil for 3 months, and she did clinic every day, and it was accepted in their college as a clinical practice hours.
Okay, nice.
We have cooperation with a university in California, 5 Branches University. We receive their students for they call DAOM, it's like doctorate in acupuncture, oriental medicine, and they call it clinical rounds here in Brazil. So when we have people from other countries, we do some special programs in their own language, normally English or Spanish, and we do the clinic. So they can have special classes, and also they can observe and practice in the clinic. So we receive it from Canada, from America, from Argentina, Portugal, German, and other countries as well.
And you also have an annual trip to China.
Yeah, that's the big event for the students. They really like it. Once a year we go there. We are resuming this next year, 2024. So normally it's like 3 to 4 weeks, and we normally visit 3 cities. 2 for studying, 1 for visiting, because that's the thing. I believe that getting them to experience in different cities, they can observe different lineage of learning. Because sometimes a doctor is very famous in one province, but then you go to another province, he's not that famous. It's not because he's not good. It's because in that province there is another guy that's really famous. So I try to show them this. For example, if you think about Tianjin, they are really famous for neurologic acupuncture treatment. When you think about Jiangxi, they are really famous for using moxibustion. You go for Guangzhou, they are famous for flying needle. So every province, they are very well known for a specific or a set of specific methods. So normally I visit those universities, I experience with them, then I find out what is the best topics for presenting to the students, then I prepare the program and take them there.
Well, that's once again, I'd like to thank you very much for this interview and for showing us around. I really meant it when I said, like, you know, when you're the entrance hall alone, it's like a piece of China. So you're really introducing not just the TCM and the philosophy and the culture, but it's also the whole experience when you get here.
Thank you very much. It's my goal. I need to say, Chinese medicine changed my life. I used it to study to be a lawyer, then I gave up that, and I went totally into Chinese medicine and acupuncture. It changed my life. So everything I own nowadays, it's related to Chinese medicine. So I really feel in depth to give it back to the community. And what I say to the students here in the college is that once you learn something, if you keep it for you, it will be only for you. If you spread it, it's built for you and for the others. And people will notice that you were the one spreading it. So spread your knowledge, spread your information. That's how I tell them, and that's what I do. Every time I go to China, I learn something. When I come back, first thing I collect I collect the teachers. I put those information and let them spread it. That's what I'm willing to do, promoting Chinese medicine. So I'm really grateful you noticed, and I think we can cooperate more. And if audience has some questions, I'm free and open to answer them, and just let me know everything.
Yeah, it's great. It also fits really perfect with the philosophy of TCM community. Of course, it's introducing all natural medicine to the global audience.
That's great.
And I hope we're welcome back here again next year, maybe.
For sure, you're my guest.
Okay.
Thank you very much. Thank you.
Thank you.